applause, please. Thank you.
Thank you. Good afternoon, ladies and gentlemen. Thank you for joining us today. I am Rendra. I'm the manager for DAN in Indonesia. And here I'm helping my team, the DAN World Asia Pacific, to introduce our distinguished speaker for this afternoon. You will likely know that Diverse Alert Network, or DAN, as the provider of emergency medical evacuations and dive accident treatment coverage. But DAN is much more than that. As a diving health and safety organization, it is our mission to improve diving safety and reduce incidents through research, training, and education. You may not know that DAN has an internal medical department that fields our 24/7 emergency hotline. So when a diver calls the DAN hotline, they are speaking to a DAN medic or doctor, not an external provider. As part of our mission to support divers, we have introduced a local Malaysia emergency hotline number for divers to call DAN at the cost of a local call. Sorry. It's not moving. Wait. It's not working. It's not working. Okay. Importantly, the DAN hotline is available to all divers for advice. However, we can only organize an emergency medical evacuation and treatment and pay for associated costs for current members. Our Malaysia hotline is serviced by a team of local doctors with diving medicine training to simplify communication and provide increased support for local divers. So the Malaysia hotline services the line in Bahasa Melayu and also English. Joining us today are Brigadier General Dr. Andrew Ng Wai Un and Lieutenant Colonel retired Dr. Lee Chin Tang. Dr. Andrew is the head of Diving and Hyperbaric Medicine Services with the Malaysian Armed Forces. He is an anesthesiologist and diving/hyperbaric physician and has been involved in diving medicine since 2002 while working as a diving medical officer at the Institute of Diving and Hyperbaric Medicine, Armed Forces Hospital, Lumut. Dr. Andrew is one of the founding members and current president of the Asia Hyperbaric and Diving Medical Association, or AHDMA. Our next speaker is Dr. Lee, who has served for 13 years in the Armed Forces Health Services and retired as consultant and head of the Department of Diving and Hyperbaric Medicine. In 1997, Dr. Lee was appointed head of the newly formed Diving and Hyperbaric Medicine Department at the Lumut Armed Forces Hospital. He has since been in private practice providing the first civilian consultant, hyperbaric and occupational medicine services, as well as consulting for several commercial diving companies and tunneling projects. Dr. Lee is also a former president of the Asia Hyperbaric and Diving Medical Association. So let's welcome our two distinguished speakers for today who will speak about common injuries, case examples, and the diving emergency hotline in Malaysia. Dr. Andrew.
Thank you, Ronnie. Thank you, Dan, for inviting us. Thank you, MIDE, for allowing us a platform to speak a little bit on something a bit more serious. In spite of all the shopping for diving, shopping for equipment, a lot of excitement in a new place. So just allow me for the next 15 minutes to cover some of the most common diving injuries that we keep getting questions on. And then after that, my Sifu will take over and give you a case summary of some of the cases that we see. So one of the most common diving illness or diving injury that we always get is barotrauma. So barotrauma, by the word itself, baro is pressure, and then trauma is injury. So it's injury due to pressure changes. And I think as divers, all of us will like experience this sometime or another. It's one of the first things we learn as we go diving. We need to clear or equalize our ear. So in fact, this is the most common problem, ear barotrauma, or we call it ear squeeze, whereby because of the changes in pressure, you get firstly pain in your ear, and then if you don't do it well enough, or there's a problem, you're unable to clear or equalize your ear, you get pain, and then you can even rupture your eardrum, all right? By itself, it is not really life-threatening or dangerous, but if there is a rupture in your eardrum and cold water enters into your middle ear, it can cause you to get dizziness, vomiting, and you may panic and get into real trouble, all right? So that's why this is still an important thing, even though it's sort of pretty common. Over on the far left, you can see all the changes in your eardrums in the different stages of ear barotrauma. So the advice here is to have a correct technique when you are clearing your ears. Make sure you are upright, head up position. Make sure you clear frequently, and then control your descent. And if you are having any cold, nose block, and so on, it is better not to dive, maybe for a day or two until it clears up, right? The other common barotrauma is sinus barotrauma, and it's illustrated in the picture down on the left-hand side, where you see blood coming out from your nose. It looks scary, but it's actually not that dangerous in a sense. It's occasionally common, especially if you have blocked nose and people with chronic sinusitis. Then the pressure changes causes pain and also some bleeding from your nose. Okay, so these are the common things that we get. The next one that I want to talk about sorry, technical problem. All right, the next one I want to talk about is decompression illness. Even though it's not as common nowadays compared to, say, 10, 20 years ago, but this is still one of the more common phone calls that we get in our hotline. And decompression illnesses is something that I think most divers is pretty aware of, but maybe they're unsure what it exactly is about. It actually composes of two mechanisms on how you can actually get decompression illness. One of it is arterial gas embolism, and another is decompression sickness itself. Both have different mechanisms. So the one with arterial gas embolism is actually similar to the barotrauma that I mentioned, but this is due to pressure changes and injury to the lung. So one of the first thing that we learn as diver is never hold your breath, correct? Because if you hold your breath and you ascend, your lung is going to expand, and if you expand too much, especially if it's a panic ascent, it will rupture. And all you need is just one rupture, one small bubble enter into your bloodstream, and that's it, okay? So what happens is that a small rupture in your alveoli, which is the smallest part of your lung, one bubble enter into the capillary, and because usually as divers when we are ascending is head up position, then the bubble will tend to travel up to the brain, right? So the patient or the diver will ascend, arrive at the surface, and immediately, almost immediately will collapse. They have stroke-like symptoms. So this is one of the most dangerous diving problem or diving illness that we encounter. You can actually die from it. And the most important risk factor is breath holding and also any abnormality in your lung. So it's advisable if you have things like asthma, you have a previous lung surgery, please speak to your diving doctor. Not a doctor that dive, but a proper doctor that has been trained in diving medicine to advise whether it is safe to go diving or not. All right? So the symptoms that I mentioned just now, because it goes to the brain, you can get stroke-like symptoms. You become unconscious, you become paralyzed, even deaf, all right? And occasionally, the diver actually recovers after a few minutes because the bubble actually goes through. It goes through, there is more oxygen supply again, it recovers consciousness, but then after maybe 20, 30 minutes, you may then become unconscious again. So be very, very aware of this. If one of your friends suddenly loses consciousness and then regain again, don't think that everything is fine, let's continue diving. You have to really monitor him and get advice from the medical doctors or medical personnel. The next mechanism for developing decompression illness is bubbles from too much diving, or rather you do excessive diving. So in this form of decompression illness, we call it decompression sickness, is due to a reduction in pressure and bubbles develop. Okay, this one we are very aware of it, which is why we got so many shops selling fancy dive watch, fancy dive computers. It's not because you want to wear it and then you want to compare with other people. Look, I've dived so long, I've dived so deep. It's actually for your safety. You have dive watch, you have dive computer. It's to tell you when you need to stop diving, when you can dive again, because you don't want to have bubbles in your body. Okay? So the factors are depth, duration, and ascent rate, meaning that the deeper you go, the longer you stay underwater, and if you do not decompress or ascend in a proper control rate, following all your decompression stops and don't do your safety stops, then you have a tendency of developing a lot of bubbles. And when the bubble overwhelms your body, then you're going to get symptoms depending on where the bubble goes. Yep. So you can get things like to the brain, become unconscious, headache, to the spinal cord, you can get paralyzed. In fact, I just treated a patient about a couple of weeks ago when diving in Batangas in Philippines. Did 5 days of diving, about 12 dives. After the dive, 4 hours later, he just couldn't get up from his bed, and he required 12 treatments of hyperbaric oxygen therapy. He's still on physiotherapy, still on wheelchair. Okay, so it's something really real. Yeah, it's not common, but it's something really real and need to be aware of. Do not ignore your symptoms. Okay. So pain, fatigue, nausea, dizziness, weakness, skin rashes. These are all some of the symptoms. In fact, it can be anything. As long as some symptoms occur after diving, you need to think of decompression sickness, all right? So what are the treatment if you have any diving injury? Okay, it is a big topic, but just to quickly summarize, basically, you want to give first aid in terms of oxygen, all right? So this will actually help improve the outcome a lot. Oftentimes, we see patients coming to us and they were not given oxygen. The outcome is poorer, okay? So when I go diving, I will really make sure that the dive shop or the dive center have good oxygen supply. That is the most important thing for me. If it's not, I'm not going to dive with them, because it's one of the first things you can give that actually can have some improvement. So if you provide it early, the moment you have onset of symptoms, you need to provide it in the adequate amount and flow rate to actually get the effect until you sought medical advice, okay? So the symptoms, like I mentioned before, is pretty similar. Arterial gas embolism can be a bit faster. Decompression sickness can be a bit slower, maybe an hour later, but it doesn't matter. As long as you have symptoms after the dive, you need to think of decompression illness, okay? So I have here, how do you give oxygen? You want to give as high as concentration as possible. If you can give 100% oxygen, even better, but usually you don't have 100% oxygen only available in hospital. You have other devices. So we usually want to look for this kind of box. Yeah, we call it a DAN oxygen set. If you have it, your dive operator have it, hopefully it's been well maintained, then that will be something they'll be looking for, a safe dive operator. So you will have various devices. You'll be familiar with things like high flow oxygen mask. You must have this bag here, right? Or something like this, where it's called a demand valve, similar to your scuba diving thing, where you need some effort to breathe, right? So all these provide almost 100% oxygen, about 80–90% oxygen. But if the dive shop or the dive center have only something like this without a bag or a nasal prong, just for the nose, it's not enough oxygen. Okay, it's not enough oxygen. If you have this, even better. This is for a patient who is already obtunded, can't breathe on their own. Then the medical personnel will be using this to provide oxygen. Okay, and I hope you all will also get a pocket mask. Keep it with you when you go diving. At least you can give some CPR mouth to mouth. Okay. So the various type of masks will depend it depends on the, will deliver a different amount of oxygen. So what you want is a non-rebreather mask. The one I show you is the bag, so that you can get up to 80-90% of oxygen, or a back valve mask, the one over there, and one with a demand valve. These are the three that is recommended by Dan. Okay, so we also have a manually triggered one, but I don't have it here, where you actually press and deliver oxygen to the patients. Okay. So these are the flow rates that I mentioned just now. If you use a pocket mask, you get only about 50-60%, but better than nothing. Yeah. Non-rebreather mask up to 80%, whereas the back valve mask or the demand valve will give you almost 100% oxygen. All right. So I'm going to stop here. I'm going to hand it over to my Sifu to tell you about treatment, the actual definitive treatment if you are diagnosed with decompression illness. Thank you.
Thanks, Andrew.
Go forward.
Yeah. Just testing whether it works or not. Oh yeah, it works. For a change, it works. Yeah, I'm going to continue. Actually, I don't have to be here, but because Andrew is still in government service, he just like to share out the workload. So I'll go straight into treatment of decompression illness. And the first thing to remind ourselves is that actually, if you give oxygen is just first aid. So if, not just like any illness, if you have given first aid, you still need to send your patient to have some definitive treatment to solve that problem. So hyperbaric oxygen treatment or recompression treatment is the treatment, the standard of care for decompression illness in any situation. Now there are exceptions. We don't have time to talk about exceptions. We can discuss this in the booth after this little talk. In 2006, there's a panel discussion on the management of mild DCS on very remote areas where you cannot get into a hyperbaric chamber. So what can we do? Can we just decide not to have treatment in the chamber? So that document discusses that, and if you want some information, we can let you know where to go. Okay. Now the next thing to note is that there are chambers and there are chambers. There are chambers in some islands that have been in a little warehouse, and in an emergency they open the door, they start everything up, and lo and behold, things don't really work safely or as it's supposed to be. So that's one. So you need to, if you go diving, it's a bit like what Andrew had just said, you need to make sure that your dive operator has oxygen with him, sufficient oxygen. But you also need to know where is your nearest evacuation, where's your nearest chamber, in case things turn south. So that's one thing. Where is the nearest chamber, and does it actually work when you actually need to use the chamber? It's kind of costly to maintain a chamber, and you can understand why it's sort of in the back of some workshop, shuttered up. It only sort of open up when the emergency arises, and you need to use it, and it doesn't really work as well. So that's a second thing. Now, of course, if you are a member of DAN and they sort of sort this problem out for you, they actually go and do some survey on which chamber are actually deemed worthy for the doctors and the operator to use for patients. So that's one point. You need to visit the dive shop after this. The DAN shop, so not dive shop, DAN shop. They're not going to buy me coffee. Now let's just talk about an example of what you should do. Forget about the heading, it's not a real question. So we have a diver in PNG, he dived for 30 meters, 30 minutes. He did 3 dives, which is quite typical of a day of diving. And you can actually look at the dive profile. I'll just skip this. And after the second day of diving, he developed a headache. And from the headache, he has tingling in his arms, hands, dizziness, and feel a bit woozy, haziness, doesn't think straight. It's a bit like COVID, When you get COVID, you feel a bit, you don't think straight for a while. And he was given oxygen, so good job. Via a non-rebreather mask, again, well done. 12 liters per minute, so all this information is important. And then he decided to go to the bathroom because he's been probably told to drink a lot of water, this DCS. And the moment he got up, he sort of fell on his knees, so he has weakness of his legs, and became in a semi-conscious state. So that's this patient. When Dan was called, he has already had oxygen for 2 hours, and of course in this situation, it didn't really work. So that's when Dan was activated. He was evacuated to the nearest hospital, Townsville Hospital, happened to be in Australia, and where he received treatment. Now, the thing I really want to get to is, you can forget about this. When you're half paralyzed, you can't do the Sharpen-Romberg, so just ignore that one. It's not a fair assessment of a diver when he can't really walk. Now, this is what I want to get to. So the first thing is, when you're treating a diver, you give him first aid oxygen, and then you call for help, because things can actually progress, and you need recompression treatment. And in between, you need an evaluation by a trained medic, and discussing with the doctor what you should do next. And this is where a Dan hotline sort of works very well. To be honest, organizations like Dan are the only one where a diver actually talks to a doctor online and gets some advice. If you have a heart attack and you call 999, they're not going to give you advice over the phone. They'll just send the patient to me. So I think this is the only organization where it's unique for divers, that you can actually talk to a diving doctor about your condition, and you don't pay a single cent for it, or you pay the Dan insurance, of course. Yeah. Now, let's talk about, is this a modified one or is it a pinch? Let me just go through and see whether the one I want to say are here or not, because it looks like it is not. Oh yeah, it's not. I think this is the old. Is it at the end? Okay. Okay, it's at the end. They promised me. Okay, I'll just keep going. So in summary, this is what you should do. Have enough oxygen, give oxygen, that's first aid. Then talk to Dan. Get some advice where you need to go. Now, if you are Dan insured member, you will be evacuated to the nearest chamber that works. And I think Dan also promised you that you'll be talking to a dive medicine physician who actually knows what to do in the event of a decompression illness. Sometimes when you talk to a doctor in a village where it happens to be in a dive site, and the doctor hasn't a clue what is decompression illness, and sometimes you get wrong advice, which is not to your best interest. So, good idea to have some Dan insurance to get yourself sorted out in situations like this. Now let's talk about injury prevention. You want to prevent going to a Dan doctor, right? You want to prevent seeing Andrew or myself. That's the best thing that can happen to a diver. So how do you prevent getting decompression illness? Well, make sure that you are in good health most of the time. I know we all eat McDonald's, we all eat KFC, and we all, our waists are getting bigger. But you need to get some degree of physical fitness. And physical fitness, those people who are, let me tell you about an interesting study. There was a time in the UK when they actually had, there was a research question, and they say, now, if we have divers who are really fit, compared to a couch potato, like Andrew and myself, doctors. If we were to go diving, are we at higher risk of getting decompression illness compared to somebody who is fit? So this researcher in the UK actually get piglets, and he had divided them into two groups. So one group are couch potatoes, he just feed them, and they eat, and they eat, and they eat. And the second group, he actually put the piglets on treadmill, and he runs them every day, feed them, but run them every day. And at the end of a period of time, he dived these piglets into a very provocative dive profile, stayed them for very long, and rapidly decompressed them. And guess what? The fit pigs survived. There were more survivors in the fit pigs compared to the couch potato pigs. Of course, they don't survive the barbecue after that, That's in the UK. They did that research. And since then, we have a better understanding that divers actually who are fitter have a lower risk of decompression illness. There you go. Yeah. McDonald's is definitely not going to sponsor this talk. Now, the second thing is gear maintenance. Make sure if you're going to hire gear, make sure it works. Because I've been in dive situation where, because I'm Malaysian, I'm from Ipoh. we don't want to spend money on expensive gears and a higher gear. And for some reason, the thing keep inflating when I'm at 18 meters. I was at risk of shooting up to the surface. It doesn't work. Of course, I didn't die, otherwise I won't be here. But keep your gear under good maintenance. It makes sense, because those are the things that are your life support when you are underwater. Unless you have gills, that's a different thing. Plan your dive and dive your plan. Now, I shouldn't be talking these things. I'm a doctor, I'm not a dive instructor. But these are common sense. Learn how to have good buoyancy control. You don't want to be doing, seesaw dive. It's very tiring, if you're diving upright because you have so much weight and you're sort of trying to swim head up and feet down, You should go down, feet down, but you shouldn't swim horizontal with your head up and your feet down. So learn to have good buoyancy control. It makes a lot of difference in your exercise. And the more you exercise, the more nitrogen actually goes in. So you're increasing your in-gassing, making you at risk of decompression illness again. Don't dive beyond your training. So if you feel that the sea condition is just not what you like, then just cancel the dive, You can ask for your money back, you can argue with the dive operator, that's your business. But use some common sense. Don't do critical thinking based on economics. Because I paid money, I must finish my dive. That's being very Malaysian, very Ipoh especially. That's where I come from. Run out of air. Surprisingly, there are still enough divers who run out of air. I don't know. Have you heard of, show of hands, any of your friends who go diving actually ran out of air? And yeah, there you go. So, dive your plan your dive. That doesn't happen. And take some personal responsibility. Now, don't forget, you're supposed to be diving with a partner, and you have sort of screwed up and you don't care about your equipment and your dive profile and don't plan. I don't want to be a dive buddy, right? You don't want a dive buddy who is all messed up and just gung-ho, nothing will ever happen to me kind of a diver. Now, I quickly move on because the next crowd is coming in. Oh, yeah, I've done all that, right? Okay, I'll keep going forward. Yep. Oh yeah, this is what I want to get to. So in an emergency, when you're going to call Dan hotline, if things turn south, this is why we are doctors. We are talking about things. We're always the bad news, This is what you should do: gather information, right? If you can't gather information, ask your buddy to gather the information. Now, what information do you want to do? Well, this is what I want to show you. You are divers. Intuitively, you know what this is, your dive profile. So how do you gather information? Well, start from the beginning. Before the dive, just ask him about his medical. Is he on medication? Has he been to a hospital? Has he had brain surgery recently and shouldn't be in the water, but nevertheless he's been diving? So go get those information, get his list of medicine and drugs. That's number one. Number two, get his age. So if somebody, like Andrew said, have arterial gas embolism, is on the floor, you don't know whether he has a stroke or he has gas embolism. So how do we know that? Well, if he's about 60 years old and diving and has high risk of diabetes, hypertension, and never take his medication, then there's a possibility it's a stroke. It may not be an arterial gas embolism. But we still believe, we still work as if it's gas embolism, but it's good information to know. But if he's a 19-year-old diver and he's on the floor unconscious after a dive, then it's very unlikely that we'll be thinking about a stroke and sending him for an MRI, right? So the age is very important, not the gender, okay? The second part is, next piece of information is what happens on descent. Barotrauma, unable to equalize. And that's a very interesting thing that I want you to think about. I'm not going to answer it here. There's a thing called the inner ear barotrauma, remember? Have you heard of that, inner ear barotrauma? If not, then never mind, I'll skip that one. We can talk about it in the Dan booth if you have questions about inner ear barotrauma, because it's funny. Barotrauma only happens in air spaces, but there's no air space in the inner ear, right? Problem on descent, usually is unable to equalize. Problems at the bottom. When you are sort of swimming, looking at the mermaids, maybe you get stung by sea creatures and that produce, or perhaps you're swimming against a current and you're exercising a whole lot, so you're in-gassing a lot. So that could probably increase your risk of a DCS. So those kind of information are useful. On the way up, Do you lose buoyancy control? You ran out of air, you panic, you shot to the surface. So those information important. So you intuitively, you know what to collect. You just have to be systematic about it. So before the dive, on the way down, at the bottom, what happens on the top, what happens when you arrive at surface. So in this situation, let me just plot. I'll plot for you the chat that we had seen just now. So we don't really have a lot of information on what happened before the dive, which is here. And the laser is not working. So A1, before the dive, we have no information on that one, never mind. On the way down, we presume he had a good dive. He managed to go down without air barotrauma. And he's at 30 meters, 30 minutes. Anybody has your dive calculator here? That's a decompression dive. He should have a, that's not a scuba dive. Scuba is sports diving. It should be a no-D dive. So he's already at high risk. So that raised a red flag straight away, at least in the doctors at the end of the phone. The second dive, 22 meters, 65 minutes. That's decompression dive. 18 meters, 60 minutes is okay, but 22 meters, 65 minutes? Of course, he developed headache. And then 20 meters, 50 minutes, safety stop all done. And he had symptoms after the last dive. So this is how you can plot out all the information nicely. And we can actually fax this over, take a picture, WhatsApp over. This saves you a lot of discussion. Even if you speak Timbuktu and we don't understand, if we see this, we know what happened to you, right? And those are the timeline of what happened to him when he first developed his symptoms. Oxygen was given, whether it improved or doesn't improve, how much oxygen was given, how long was it given. Sometimes people tell us oxygen has been given. How long? Oh, 10 minutes, because the cylinder is so small, it just ran out. And that's why there's no improvement. So this kind of information is what I want to leave you with as divers who wants to either help your friend or help yourself when you do a call to the DAN hotline. These are very useful information, at least for us at the receiving end, to make decisions on what to do with you. Well, hopefully not to do with you, but with your friend. So when you call a DAN hotline, what do you expect? Well, you'll be expecting somebody like Ronnie to be speaking on the phone, trying to get those information from you, and then deciding, okay, I'm going to switch this call over to either Andrew or myself or a few other diving doctors who is on DAN sort of a call list, and we'll be discussing the situation, what to do with the diver next. So these are the information, and I've spoken about all this on the little diagram. And if you just have that diagram in your brain, sort of smear on it, it will work very well. And of course, then the doctor will talk to you whether this is decompression illness or if it is mild, we need to do some other tests, and we'll probably send you to a nearest hospital to get some things checked out, and then perhaps looking at evacuation or putting you in touch with a hospital who has a chamber who can treat you adequately, right? Yep, these are all covered. So, again, if you go diving, make sure you have enough oxygen. Make sure, I'll sound like a salesman, Make sure you have some cover most good divings are in remote location. It's not next to a big general hospital who can look after you. So make sure if things turn south for whatever reason, you have people there to help you. And people who are well trained to help you, who are accustomed to looking after divers, not just general illness. And when you call DAN, make sure you give your contact number so that we can call you back. Sometimes we are so busy trying to manage how to get you into good clinical care that we forget to ask you for your number, and you forget to tell us, and we say, oops, shucks, how are we going to get hold of you to get things moving? So that's very important, right? And the last bit is more advertising. The good news is there is a DAN hotline in this region. Indonesia, Malaysia, Philippines, Thailand, Australia, under DAN World. So visit the DAN booth, see whether DAN works for you or not. I know if I go diving, I want to have that assurance because the good dive sites are usually far away. And if you Do you know how much it costs to evacuate somebody by private air to another country? Any idea? Anybody fly aircraft here? Anybody owns an airline? I don't know, it's in the region, it's some ridiculous amount of about 100,000 US. Yeah. So if you have 100,000 US dollars in your bank, 100 times over, you can afford to spend that money on an aircraft to bring you someplace for treatment. But if you don't, then it does make sense to have some coverage so that you can dive safely, happily, with peace of mind. And that's information about our booth. So we'll be quite happy to talk to you. If you have any questions, and we'll be there until 6 p.m. We'll be there until 6 p.m. Thank you very much.
Yes, once again, give a round of applause, please, and thank you to Dan Will. And the topic was called Common Diving. If you need more information, walk up to the respective booth. And thank you, sir, for joining us on the 17th Malaysian International Dive Expo.